Morning, everybody. I hope this is working. First time ever on Facebook Live. Hi there. I'm Dr. Jennifer Essie. I'm with Carolina Hearing Services on Daniel Island. We're a suburb in Charleston, South Carolina. I'm an audiologist. I've been practicing for about 22 years, and I'm here to talk to you today as a brief, not only introduction to our group and practice, but to how we're keeping everybody safe within our practice, our patients, our staff, anybody that walks in the building, basically, what we're doing to help provide precautions against COVID-19. So this will be pretty brief. You can shout out questions. I can see a chat bar as long as I put my goggles on here. If you can't hear me or anything's not coming through, just give me a shout out. I'd like to start off by saying that we did shut down for 4 weeks. Our office was completely closed to patients. I was doing some remote care from home. We are able to do some logging in to provide telecare now with audiology and hearing aid healthcare. So I was fortunate enough to be able to do that for the majority of our shutdown. But once we started to come back, we introduced curbside service. So if you had an issue with your hearing aids in particular, we would, or I personally would greet you curbside wearing PPE, which is personal protective equipment, and we would safely sanitize the hearing aids before treating them, treat the hearing aids, and then return them to the patient fully sanitized as well. So that worked for a couple of weeks while we were reintroducing ourselves back into the office atmosphere. Staff started coming back around the earlier part of May into the middle of May. And then we started doing what we're calling gap scheduling. So really what that involves is simply breaking apart appointment blocks. So instead of having overlapping appointments or multiple patients in the office at once, like we would normally do to serve more people efficiently, we gapped the schedule with 15-minute breaks in between appointments so we could fully sanitize everything. And I mean chairs, tables, countertops, pens, all of our equipment that I use in the back, our test equipment, hearing aid treatment equipment. And so we do continue to do that still. We think that is one of the safest measures at keeping everybody safe so that we have time and space to clean without anybody in the office in terms of patients. So in my office in particular on Daniel Island, we have 3 of us. There is me as a provider. We have Caitlin Walsh, our audiology assistant, and Diane Porter, our fantastic PCC, our front office manager. And between the 3 of us, we keep everything sanitized fully. Also, when we are in any kind of contact with patients within 6 feet or less, we are wearing our PPE, our personal protective equipment. This is a KN95 mask, which is the subset mask to the high-grade medical N95s that you've been hearing about, which were extremely hard to get early on. They are becoming a little bit more available now. So this is the highest level of protection. And then of course the standard medical mask that you see everybody wearing with the pinch top. This is typically what I'll wear if I don't have to get super close to somebody's face, although majority of time I do. Pinch tight at the nose, no breath spaces for aerosols to escape out the sides. In addition to this, with my particular profession, because people don't always hear well, they do rely on speech or lip reading. So I do have a face shield that seals very tightly around my forehead. I'm sure you've seen it in the news and in medical shows and things that you've watched, but that is very effective for allowing me briefly to release my mask down below my chin so that I have space to allow them to read my speech. So that's worked in cases where that is necessary. As far as testing, I do have to get within inches of somebody's ear or face, and so I usually ask permission to do that. Of course, when people are coming in for appointments or prior to booking an appointment, we are also asking the standard questions. Have you had a fever, been ill, family members been ill in the previous 2 weeks? We are not screening temps in our office, but it is something that some of our locations are doing. Cleaning is something that I already touched on, but I do want to emphasize the materials that we're using to clean. They are medical grade, antimicrobial and anti-germicide. So we have the, if I can get this to the camera, the high-tech stuff, not the low test, and we do spray, wipe down, clean with gloves, and then re-wipe it each and every time. We have aerosol, Lysol sprays, and versions of that we've been using as well. And there are no coffee machines, no magazines, nothing in the waiting room other than pens and clipboards that we sanitize as well for patients to interact with, just to keep that space safe as well. Additionally, we initially started keeping the door locked. When we first opened, we were really trying not to allow any walk-ins, which in my practice can be common. When you have a hearing aid fail on you, you want to walk in and be able to have it serviced, which we take pride in doing most days. For now, we are just starting to get that back up and running, but we do ask people to call ahead. We're trying to schedule those instead of having simple walk-ins as we used to do. So we're starting to get back to a little bit more of a normal schedule, but still doing the gap between. If you have any questions, any concerns before you make an appointment with us, we don't want you to hesitate to call. You can visit us here on Facebook, Carolina Hearing Services. My location is Daniel Island. Pardon me. We also have West Ashley and Somerville in the Tri-County area. So we are here to serve you if you need us. We are your resource for better hearing, and we hope you'll trust that we'll take very good care of you. I would like also to introduce you to our office phone number, because if you go to the Facebook page or the Google website, you will find a different phone number that tracks to our call center, which is great. But if you wish to speak to Diane, Caitlin, or myself directly, that number is 843-971-4199, and we are happy to answer any questions you might have. So I've taken up about 10 minutes of your time. I hope you all are having a great morning. It's just been fun. I've talked a lot, and I see a little note from Allie. What are you doing for people that cannot come to the office? That's a great question. We can do remote support. So like I did while we were shut down, I do have programming capabilities for certain types of hearing aids. Certain instruments have a chip in them that allow me to access the chip through an app on a phone, and I can remote in safely and securely that way if the technology is available to the patient. Not all hearing aids are ready for that, but some of the newest technology, if you've purchased them within the last year or even two, they may very well be ready for app-compatible remote support. Please call or contact us and we can get you set up for that. Sometimes you don't even have to come to the office for us to set up that app. We can do a lot of that by phone. Also during shutdown, we did a surprising number of cleanings by phone, which sounds kind of strange, but if your hearing aid does get dirty with debris or wax, for example, we can instruct you over the phone or have somebody close to you help you change some of the very simple parts. And if you don't have the parts that we instruct you to change, we can send them to you. So it's not complicated, you just need a little guidance sometimes, and that was a good part of what we did during shutdown as well. Hi Dana, good to see you. I'll see you on your 1 o'clock today. Thank you, friends. I hope everybody's having a great day. Bye.